So I would like to extend a very warm welcome to our eminent speakers on behalf of the Symbiosis family. We are honored to have with us today Mr. Neeraj Lal. Now, sir is the CEO, Chief Operating Officer, Apollo Hospitals, Ahmedabad, Group Senior Vice President for Medicover Hospitals. That's his positions that is held, Vice President, Cluster Head for Rainbow Children Hospitals, Group COO for Sunshine Global Hospital in Baroda. I visited that once, sir. A CEO at Babs Hospital, Baroda, Senior Vice President Operations and Quality at Shalby Hospital, Ahmedabad. You can see these accolades, you can see the education. So sir comes with huge experience and background. Now this session on digitization of hospital operations, prevalent practices, possibilities and challenges is going to be a holistic, informative and a very comprehensive. The speakers are going to cover an array of possibilities and challenges in the healthcare domain, as well as the existing practices. They will be dwelling into the impact of contemporary technologies as also the evolving and futuristic technologies and how these are and can enhance the patient experience in real time. Now, post-pandemic impact on healthcare has really changed the landscape of the healthcare segment. The adoption of technologies like IoT, that stands for Internet of Things, a real-time remote monitoring of patient vitals, telemedicine, face recognition, location tracking, AI, as we understand as artificial intelligence, machine learning, are now becoming the lead drivers in the change in the healthcare vertical. There is also predictive analysis of patient, involved in patient care, that is going to play a very important part. Having said this, may I call upon Mr. Neeraj Lal, sir, to please take over the stage. Thank you.
Hello, can we clap now? Because I'm seeing people are sleeping. You got a beautiful green campus. I've seen sunrise in the morning, which is very good. So you got a beautiful campus. It is always good to come to the great campuses like Symbiosis and Green, because we are coming from business of healthcare, and we talk about PNL, and whenever we are EBITDA positive, we show green, a green Excel sheet. And when we are negative, we show red. So you got a green campus. Be positive. So we will start the presentation, but I want the participation from the students. See, presentation is just simple. I'll be talking about three things. Number one, transforming healthcare. Thanks to the pandemic, I think pandemic has changed the role of healthcare, what we give now. And because of pandemic, transforming healthcare is in a big way. So I'll be sharing you three examples, what we were now, what we are doing in the COVID situation, and what is the future of healthcare. So we are just 20 minutes, how we transform healthcare. So I'll be taking some example, what we are doing in my previous hospital, Apollo, Rainbow, and Medicover, which is happening. So it is not a news, it is happening live. And some of the thing which we can see as a future. So since you are all the student of healthcare, you should know what is happening into the healthcare, and you can become party to that. Okay. How many times did you hear this word in the past 2 years? Everybody was talking about, apart from mask, social distancing, this word everybody is talking about. So we'll be talking something about this and their application into the healthcare. Say healthcare is the second last digital transformation, just ahead of shipping. You can thought where the healthcare is. You see banks, you see multinational, you see how the food is coming to your houses, but see the healthcare. So that was the status of healthcare. And you see, we are not fit to manage the scenario because we didn't change. Healthcare has refused to change. Apollo started telemedicine way back 25 years ago. And we have not get that jump and push thanks to this pandemic. Okay, now everybody is talking about telehealth, e-consultation. So you can see the gap. If you see the nurses, if you can see the doctors, you see the hospitals, number of bed, we are not fit to manage. And I think COVID has exposed not only our country, entire world. So if you see, when this pandemic affected healthcare, drop in the physical consultation to 40%. This is a data which I am sharing. Drop in the planned surgeries and procedure, 25%. Drop in vaccination, health checkup and lab tests, 30%. I'm not talking about COVID vaccination. I'm talking about newborn vaccination and all, 30%. And overall impact in the revenue to the tune of 30 to 40%. So like most other companies, like most other sector, healthcare has also got a big hit. And as a result, the increased operating revenues, because we have to use the infection control protocol, the PPE kits, the mask, and so on. So you know a surgery is happening on you, but you don't know which doctor it is because he or she is wearing a PPE kits, right? So all those things were happening. So what pandemic has taught us? Charles Darwin once told, it is not the strongest of the species that survive, not the most intelligent that survive. It is the one that is most adaptable to change. So I think healthcare have learned from pandemic. So continuous change is very, very important. So what is good now? You just see this graph. Growth in telehealth usage peaked during April 2020, but then it is stabilized. It means telehealth is growing now. Healthcare has seen the most unpredictable adoption of technology during pandemic. If you ask a star doctor in one of the hospital in India, please come for a virtual consultation, he will not pick up the phone, forget about video consultation. And now every consultant is coming on a video consultation mode. We launched Apollo 24/7. And now it is a big hit. People want to come. Now doctors fight. Why I'm not getting number of calls on a video consultation? So that is the strength of this digital transformation. People are now more concerned about their health. I think because of COVID, the people who are fittest, the people who are healthy, they are there. Otherwise, this COVID has exposed the people who are not good at health. I think healthcare and hospitals specifically don't use the word health. All other companies, healthy product, healthy food, everything healthy. But we people from healthcare, we don't talk about good health. So therefore, AI and IoT is a key driver of change. I'll take you to some videos. Here, just one more data. If you see the consumer shift from 11% usage of telehealth in 2019 to 76%. See what pandemic has done. The people who have refused to change, they are changing. See the healthcare provider side from 50 to 175x. Health system, independence practices, behavioral health provider, and so on.
Personal technology is ushering in a new era of healthcare, fundamentally changing how and where medical decisions are made and treatment is rendered through a combination of wearable health monitor technologies, telemedicine, home diagnosis, and even pop-up retail settings. Healthcare providers have begun to recognize the importance of treating patients remotely. In 2014, $2.3 billion was raised for digital health startups, and between 2011 and 2014, $1.9 billion in capital was raised for companies aiming to use predictive analytics. By 2018, 70% of healthcare organizations are expected to invest in medical mobile apps, with an estimated spend of $1.5 trillion on wearable health monitor technologies and mobile apps. This rising trend of remote healthcare, coined House Calls Plus, has allowed for a more timely administration of treatment for patients at their homes, significantly reducing the cost of intervention, as well as improving the quality of care. Pilot programs are showing excellent results, with one program in the US reducing admission rates to hospitals by 18% for its diabetic population who use remote monitoring and communication, and their readmission rates have also dropped by 31%, all of which reduced costs to the test center by 7%. An alternative to hospital-run healthcare programs is the drive towards patients using wearables and other personalized technologies to receive a variety of readings, which they can directly compare to a number of benchmarks and decide whether or not to proceed to a healthcare professional. Other patients may instead choose to consult health social networks to share information from their automated readings, consult a physician during Q&A sessions, or even seek emotional support. Patients may also use apps to detect a correlation between their condition and medication interactions or bad health practices to make decisions on how to improve their health. For more in-depth testing, patients could also decide to use home kits for personalized genomic services, blood and other biomarker testing, environmental testing, and even predictive biosimulation. Such a style of healthcare is being termed local convenience store. For those who choose to consult a healthcare expert, a number of options may arise that redirect the patients away from the hospital. Retail outlets in common city centers and clinics in remote locations can receive patients, review their information, and decide whether to continue with further care by a physician. On-call doctors are also readily available to answer questions and provide healthcare directives through video chat, email, or mobile phones to patients anywhere. Telemedicine has grown exponentially, with 72% of hospitals and 52% of physician groups in the US currently providing such services. And in Ontario, Canada, telemedicine programs have seen an annual growth of about 30% for the past few years. Among the risks associated with advancing personalized technology in healthcare is the belief that technology will take over the role of the doctor. In 2017, 142 million medical and health apps are expected to be downloaded, and an estimated 65% of consumer healthcare transactions are to be made using mobile devices. Nevertheless, hospitals and healthcare professionals will still be at the forefront of all treatment plans, especially in unique cases. Therefore, the new dynamic of doctor-patient relationships requires new collaborations and business models, as well as a revised understanding of healthcare companies' role in the value chain.
So this is the future of healthcare. This all is happening, and now I'll come back to our country, what we are doing here, where the healthcare have reached. So what you get to know from this presentation, this video, where are we? So we are graduating from hospital to homes, okay? So healthcare at home. Hospitals are coming to homes. Healthcare, for the hospital to go, you just require a procedure or a surgery or the ICU beds. You're not supposed to go hospital for primary care or a secondary care. The hospitals are coming to your place. They're taking care of home health care by a various technology. I'll just give you one more video what we are doing here in our country.
एक टैप में डॉक्टर समय नोरा फैक्टर सुबह से रात तक बुला लो बेझिझक दवाई चाहिए ए सब तो बस एक टैप हाँ बस एक टैप दवाई 2 घंटे में डॉक्टर्स भी मिलेंगे सिर्फ 15 मिनट में बस एक टैप हाँ बस एक टैप हैदराबाद टू बैंगलोर दिल्ली चेन्नई डोर टू डोर आ गया अपोलो जल्दी से आप खोलो एक्सपर्टीज के लिए बस एक टैप
अपोलो की एक्सपर्टीज पाने के लिए डाउनलोड द अपोलो 24/7 ऐप अपोलो 24/7 एक्सपर्टीज इज फॉर एवरीवन
So you can see the surge in the number of online consultation post-pandemic. You can see from May till December. So therefore, healthcare is coming to home. If we are not taking care of this application, you're not there. So all the hospital have to graduate from the traditional software in the hospital beyond. So many application which is monitoring. This video was also talking about remote monitoring. So if you go beyond this, so how we adopted technology, remote patient monitoring. So you must be knowing remote patient monitoring. So this technology started generally in the COVID times. Most of the people, 14 days quarantine packages. So we are monitoring patient for 14 days. A doctor and a nurse is giving a video consultation. If at all they require some help, they are shifted to the hospital in the ward, and ICU and all those things. So what is the benefit? The workload of the hospital goes down and only the patient which require attention, medical attention. You must be knowing healthcare has passed a very bad phase. Everybody was looking for the bed. People were talking, we can pay 1 lakh per bed, but there was no bed available. I'm sure in the city of Pune also, every hospital, people were talking about beds and beds. Only 5 minutes, okay. So, therefore, people first time they get to know about health. So, therefore, if we shift primary care to the homes by remote patient monitoring, we can able to address those things. Then technology for better operation. There's something known as RFID. So we manage our biomedical equipment through RFID. So if you use these QR codes, RFID stickers, because there is a shortage of ventilator in this pandemic and you don't know if you got 40 ventilator, where are the ventilator posted now on the patient. So this technology, you can track where the ventilator is, whether it is used, it is not used. This is some of the screenshot of the dashboard, which get to know how many medical equipment you have, CMC, AMC due, whether it is calibrated or not, in which location it is, and in which watt it is. So by a dashboard, I can see as a manager where my equipment are in use and where it is not in use, so that I can push the equipment to the place where we need it. So this technology we use in one of the hospital in Bangalore. There is something known as nurse call management system. I don't know why they have kept the name. Poor nurse has to go to the patient room for small thing. Food is not good, housekeeper is not good, my bed sheet is not good, doctor has not come, all those things. And she's not meant for those purpose. She's only there to take care of the medical part of this thing. So we use this technology through a startup. It is a 4-point system. You can see on the screen, it is a Wi-Fi device. First button represent nurse. So if you require a nurse for a medical attention, just press this button, and within that time, the nurse will come. If she's not coming, then escalation go to a staff nurse in charge there, and she's not responding, then it goes to the head of the nursing services. Second button is housekeeping, F&B, as well as maintenance. So a CEO of a hospital or a manager of the hospital can track which department is working efficiently. And through this technology, we have used 33% of the staff nurse time in only taking care of patient. She's not supposed to go to the patient rooms and ask for a food is not good, bed sheet is not good. So most of the hospital were using robots also for temperature screening, OPD registration, and so on. This we used in Bangalore in one of the hospital, Rainbow. So it is very difficult for a children to wait in the OPD. Whenever a parents bring a children to the OPD, it is very, very difficult to ask the children to wait while doctor. So we have installed this technology there. It is a floor game which is mounted on the ceiling. Just few seconds if you can show. So these are the little patients. They're waiting for the doctor and they don't want to go inside because they're so busy in playing. So if you do these small things, we can make the experience of the patient good. So it keep them physically active and engaged. It keep parent also satisfied and improve the outpatient satisfaction index. And you're talking about AI. So we actually use AI in one of the hospital in Medicover. These are the AI cameras where we used to measure the attendance of a doctor as well as a employee. So generally, if you go to a multinational company or anywhere, you have to punch in or whatever. It is it is too taxing. So we have installed AI cameras in few location along with the mood. Happiness mood, sad mood, or whatever. So whenever you're coming in the morning, if your satisfaction index or happiness index is 75%, and you are going in the evening and your satisfaction and happiness index is 42, you get a call from the HOD. Hey, you in the morning you are 75% happy, now you are just 35. So these are things you can always do. Technology, the best thing in healthcare, if you use technology, I think we can change the landscape of healthcare. You will be surprised once we install this thing in the OPD, and there a customer care manager seeing this photograph of AI cameras. One patient is looking very sad. She see in the AI cameras and she go close to the patient. Okay, sir, I understand you're not very happy. He was surprised how she came to know. Then he told, no, I'm waiting for the doctor, billing is not proper and all. To use this technology for human resources, for guest relation, operation management, security and all. It is actually happening. This is the last video. It is predictive analysis. So whatever health checkup you do, right? So health checkup speaks something. Health checkup is not a report. Most of the hospital, most of the medical center you go, health checkup is a big thing. But what is that big thing? If nobody is scanning those reports, nobody is seeing those reports, and you are dependent upon doctor and health checkup patient, most of the doctors generally don't see comprehensively because they're not patient, they're customers. So if you use predictive analysis by using AI, which we are doing through Apollo Pro Health Checkup program, you just see this video, few seconds, and then I'll talk about.
It was yet another busy day for Harish and Hema. Work was intense and stressful. Balancing with home commitments made it hard to prioritize their health. Sounds familiar? Let's see what happens to Harish and Hema when Apollo Pro Health came into their life. A health program that could predict, prevent and help them overcome lifestyle diseases. Pro Health began with a set of questions about their medical and family history as well as lifestyle choices. This generated personalized tests specific to Harish and Hema. Then they went to an Apollo center for their diagnostic tests. These tests can ensure early detection of most common health conditions that often go undetected for too long. Addressing them early allows for limited medications, minimal doctor visits, and in some cases even reversal. Using an artificial intelligence tool, the doctor predicted their health risks, discussed their test results, and helped create personalized goals for Harish and Hema, and thus began their path to wellness that was all about eating healthy, regular medication, and staying fit. In a few days, they got a call from their health mentor, who shared diet and exercise tips and reminded them to update their progress periodically on the Apollo app. There was no escaping the exercise routine. The app constantly reminded them to complete their daily physical activity. Their prescribed medication was delivered right to their doorstep, and doctors were always available for check-ins on their progress. Pro Health is designed to make you healthier tomorrow than you are today, with the support of Apollo doctors. Get onto Apollo Pro Health now. Call 1860-500-0707 and take full control of your health.
So if we know about health parameters, say for example, we do so many corporate health checkup, 500 people coming, 600 people coming, most of the corporate, if you use SBI, Torrent, and so many pharmaceutical companies. But this poor CMO, medical officer of that corporate, what he will do with that report, he'll ask some executive to write on the Excel sheet, blood sugar level high, hypertension. So what we do, we'll shift that report to our AI platform, and a dashboard is made. So we can tell out of 600 employees, n number of employees is having a hypertension, n number of employees having this, and you can take a call according to the diet in your campuses and whatever. So out of 600 screen, only 10% require this percentage and all. So if you do these kind of predictive analysis, I think this will change the work, and accordingly a health mentor will guide you what to do next. This is important for you as a hospital managers. Typical OPD. A patient goes, there is a time in the registration, of course through a software, then he need to wait for a doctor write prescription. I don't know his writing is good, bad, God only knows. And then you come out, then you have to go to 3 places. You have to go to pharmacy, you have to go to lab, you have to go to radiology, right? So this is known as, we started CSP. that is care suite persona. So it is linked with the appointment system in HIMS. Whenever a doctor, you are taking appointment from a particular doctor, it is like a book my show. So if you want to take an appointment from general surgery, you see which doctors are available. Take the appointment. So if I am Dr. X and somebody want to see me, so I can see in my appointment schedule how many patients is there for the day. It is linked with HIMS. As soon as patient takes an appointment, it is reflected in a doctor dashboard, and all patients are billed for the consultation come on the dashboard. Out of 5, 3 are billed. Therefore, it is linked with the nurse module. She'll take the vitals. It is visible to the doctors. Otherwise, nurse will write somewhere in the extreme end, height, weight, and BMI and all. It calculate inside like BMI, okay? And then, all the predefined templates, different specialties, because every specialty got different templates. If you want to, it comes. Voice recognition, doctor is not supposed to write. He just saying, and automatically a prescription is made. A machine learning is there, and it is linked with lab management system and PACS. So this is a video, but just go ahead. So it works like that. Some of the screen boards I'm showing, doctor dashboard with the voice recognitions, then artificial AI, what prescription you have done earlier, it will come there. Earlier you have ordered this. There is a readily available templates with diagrams. If doctor want to explain to somebody what is happening in your body, he has to make a drawing. If he's not a good drawing teacher, he cannot able to make good drawing. So this is good. A diagram will come, he can just mark. There is a place where something is there, you need to go ahead with this. This is interaction with PACS, medication chart. That's all for me. So, thank you very much. I just want to share what is happening into the healthcare. I'm sure you get to know, become a part of digital transformation. Thank you very much for your time.